Hello, my name is Anna Romaniuk. I'm an immunologist, microbiologist, and psychodietitian. I'm a diet coach and consult patients with various diseases, from infections to autoimmune diseases and methylation disorders. I'd like to thank Lifeline Diag for the opportunity to share my knowledge and experience with you. The topic of today's meeting is a functional approach to treating Hashimoto's disease. If I were to say in one word what a functional approach is, I'd have to say that it's simply personalization. Everyone is different, and everyone needs a different approach, a different diet, different supplementation, and fine-tuning. Hypothyroidism is extremely common. In the United States, it is recognized that 20% of the population suffers from this disease, of whom half are unaware. Hashimoto's disease causes 97% of hypothyroidism. And what's interesting, as I've already said, half of these patients don't even know that they're unwell. They're not diagnosed, they have symptoms, but don't undergo treatment. Hashimoto's disease is also called chronic lymphocytic thyroiditis or autoimmune thyroiditis. Cells or effector mechanisms in this disease are antithyroglobulin and antithyroid peroxidase antibodies. It's not limited to these because Hashimoto's is a disease that's type Th1, i.e., mechanisms involving cytokines such as interferon, interleukin-2, sometimes TNF-alpha, and these are cytokines produced by cytotoxic lymphocytes, i.e. CD8+. Why am I discussing this? Because the opposite disease, hyperthyroidism, is more associated with the Th2 response and requires completely different supplementation. As you probably know, some patients have Hashimoto's symptoms and it doesn't even cross their mind to get tested and try the treatment. Very often, patients realize that something's wrong because they have little energy, lack of concentration, and start gaining weight for no reason without changing their diet. Symptoms also include facial swelling and frequent constipation. What's the reason? What's the cause of Hashimoto's disease? Of course, traditional medicine treats symptoms, but what we're going to do is look for causes. The cause of Hashimoto's disease almost always starts in the gut. Gut flora disorders, gut dysbiosis, cause immune dysfunction. The immune system simply begins to attack its own tissues, in this case, the thyroid. I'd like to add here that women are much more likely to suffer from Hashimoto's than men at a rate of 10 to 1. It means that only one man struggles with this disease per 10 women who have the same illness. This is because women have a higher level of estrogen that promote the antibody response, i.e. B-cell response. Therefore, they are more likely to have elevated antibodies, etc. And so this autoimmune process starts. An unbalanced immune system with a predominance of Th1 or Th2, where Th1 is characteristic of Hashimoto's, Th2 for Graves-Basedow, requires other supplementation and a different diet. People suffering from Hashimoto's often switch to the paleo diet, which, as you know, is a diet without carbohydrates, high in protein and fat, rich of omega-3 and a large amount of choline, which is found in meat and eggs. This diet lowers Th1 levels. So you could almost say that the paleo diet is healing for Hashimoto's disease. But it's not recommended for people who have a CBS mutation and who are struggling with an excess of sulfates of ammonia and insufficient glutathione. So, please be very careful if you plan to go on a paleo diet if you have Hashimoto's disease. The other side of the coin is the Th2 response, which we want to strengthen a bit. Th1 and should eliminate certain products from the diet. These are primarily grains, legumes, gluten, dairy products, and generally lectins, which are in grain products. This is very advisable for the dietary approach to Hashimoto's disease. Of course, the very restrictive paleo diet doesn't always work. And here I'd be more willing to suggest a vegan diet, which is a combination of a vegan diet with a paleo diet and allows both grains and meat. It's sort of in the middle. You could say it's an easier diet. As I said, everything starts in the gut, so we're dealing with disturbed gut flora which can be due to diet. We eat too little fibre, which helps good bacteria grow. And in regards to this, gluten consumption is also a big problem. Gluten in Hashimoto's disease is a huge issue. Anyone diagnosed with Hashimoto should go on a gluten-free diet because the antibodies that are produced against gluten attack thyroid cells. And now it's very important to determine if the patient has suspected celiac disease or if it's a non-celiac hypersensitivity to gluten. Why? Because on the one hand, these anti-gluten antibodies will attack the thyroid gland, and on the other, gluten will inhibit the absorption of thyroid hormones, which are needed in hyperthyroidism. Anyone who requires high doses of thyroid hormones, i.e. above 125 milligrams, should get tested for celiac disease. If they've been on a gluten-free diet for a long time, I recommend genetic testing that'll show if there is a predisposition to celiac disease. If it turns out that there is such a predisposition, this diet should be very restrictive, because when it comes to gluten-free diets, patients have very different approaches. Some have a very restrictive attitude, while others eat pizza once a week and think they're on a gluten-free diet. The second problem in Hashimoto's patients is the problem of cross-reactions with gluten. And here we should remember that there are many food products which include milk, and milk has casein, which cross-reacts with gluten. They're not as closely matched to thyroid cells as anti-gluten antibodies, but in very sensitive people, both casein and millet, e.g. rice, corn, oats, as well as instant coffee, which has traces of gluten, will cause problems. So it's good to do tests for type 3 allergy, so-called delayed IgG dependent, to see what other antibodies are present. Let's remember that there's the gut-thyroid axis, and gut dysfunction will cover up correct thyroid test results. Another important thing is to know your genetics, because there are mutations that disturb the conversion of T4 to T3, i.e. to this affect a thyroid hormone. Some polymorphisms are associated with negative feedback between T3 and TSH, i.e. there may be very little TSH, very little FT3, with TSH not increasing at all. And according to conventional medicine, someone like that is still healthy, although their symptoms are very advanced. Here we should also mention lactose because patients often confuse lactose with casein. Lactose is milk sugar and should theoretically not be present in fermented milk, i.e. in yogurts and cottage cheese. But unfortunately, few patients know that often whole milk powder is added to thicken the yogurt. It thickens the yogurt very nicely and adds flavour, but contains lactose. So the first thing we're dealing with here is knowledge, and the second thing is knowledge of your body, i.e. whether there really is a problem with lactose intolerance. It's estimated that approximately 70% of people who have Hashimoto's have a problem with lactose. Of course, this can be tested using genetic testing to see if there is congenital lactose intolerance. But sometimes you also need to do breath tests, which show if there's acquired lactose intolerance. If this is the case, I recommend replacing euthyrox with letrox, which doesn't have lactose. And sometimes even patients themselves provide feedback about the drastic change in their well-being after switching these two drugs. Another problem that Hashimoto's patients face is methylation. It is estimated that almost all of Hashimoto's sufferers have mutated genes, MTHFR, which is a key methylation gene. This is because insufficient methylation prevents proper DNA production and, as a result, inhibits the production of some proteins. So people with methylation disorders will have difficulty producing thyroid hormones. Is this a big problem? I think so, because 55% of the European population has at least one mutated allele, i.e. has so-called heterozygotes. This is a slightly smaller problem, although the enzyme that's formed based on such a heterozygous gene has efficiency reduced by approximately 30%. It's important to remember that. Homozygotes have a 50% reduction, so right at the outset we already have a less efficient enzyme. Let's also remember that what we eat is important in this case. For example, whether we eat a lot of products that contain natural folic acid, which is already methylated. These mainly include green vegetables, citrus, avocado, asparagus, lentils, and so on. However, it's also important whether we are well mineralized. Here, we're at the point where it's good to do a hair analysis to see how we are mineralized and whether we have the right minerals to ensure this methylation process. The minerals that are needed for methylation are zinc and magnesium. Each one works differently. Zinc converts trimethylglycine into dimethylglycine. This is the process of converting homocysteine into methionine, a so-called shortcut. However, magnesium is responsible for the production of S-adenosylmethionine, or so-called SAMe from methionine. So the lack of these minerals means that this methylation processes are much slower. And if we have a mutation, they overlap. Another important factor is a vitamin deficiency, because we're dealing with disturbed gut flora or don't take these vitamins at all, mainly group B. And another problem is heavy metal toxicity. Aluminium, lead, and mercury inhibit methionine being reproduced from homocysteine. In a way, it damages these enzymes and makes them less active. These heavy metals also cause detoxification problems. Detoxification of mercury is a very difficult issue. Most people have problems with it. Why? Why are we poor at detoxifying? Some detoxify better, others worse. This is also associated with the mutations we have, i.e. with gene polymorphisms. There will be polymorphisms of glutathione genes, which means polymorphisms of the superoxide dismutase or catalase genes, i.e. strong antioxidants. And everything we inherit from our parents results in our detoxifying ability. Zinc and selenium levels are also very important. The level of zinc is associated with metallothioneins. These are medium-sized proteins that are mainly in the intestines, but not only, they're also in the mucosa, and exchange zinc for mercury or aluminium. And in this way, what we consume in food, e.g. mercury eating a lot of fish, is naturally removed. If we have a zinc deficiency or disturbed zinc to copper ratio, this process is quite different. Mercury is a very drastic bad element because it removes glutathione from our body, lowers vitamin C levels, blocks B, B1 and B6 group vitamins, as well as affects glutathione reductase and antioxidative capacity. Now we come to selenium supplementation. I'll remind only that zinc is all about metallothioneins, and the correct ratio of zinc to copper is very important. If the hair test doesn't show heavy metals and the ratio of zinc to copper is disturbed, we can assume that we're dealing with mercury poisoning. As for selenium, it's an element that's often supplemented when it comes to Hashimoto's, and here I can honestly say that very different opinions exist. There are those, especially pharmaceutical companies that sell this supplement, who think that it should be supplemented in very high doses, preferably in the form of selenomethionine. However, some classical medicine thinks that this is going too far. Indeed, selenium supplementation reduces anti-TPO antibodies, increases the production of FT3 and FT4, but doesn't guarantee complete remission of the disease, i.e., it shouldn't be treated as a medicine, but rather as support mainly for detoxification of mercury, as well as antioxidative processes. I wouldn't be speculating on whether or not to supplement if I hadn't done any testing. If we test whether we have the correct level of selenium in our body, of course, such testing can include hair analysis. Plus, if we tend cancer, either from our family history or from genetic tests, if we know the capacity of our detoxifying enzymes, including glutathione peroxidase and peroxide dismutase, which need selenium. So considering all these factors, I would then decide whether to actually supplement selenium or not. It turns out that in our Polish diet, we have almost enough selenium. But if we want a little more, I suggest grain sprouts, fish or crustaceans. Brazil nuts are also rich in selenium, but not all Brazil nuts. Please check. I think Colombian ones have high selenium content, others don't. Of course, if we find that there's a heavy metal problem and we want to eliminate them, everyone asks, okay, maybe we should do chelation. I always say that the best chelation is good mineralization. So, to mineralize well, we must first of all start with the diet, stabilize the gut flora, eliminate our food allergies and introduce products into the diet that are high in sulfur. These will be brassicas. And then, if the mineralization is good, we'll start the process of removing heavy metals from the body. Here, multifactorial products are also recommended. i.e. spirulina or chlorella, which have a lot of B vitamins, antioxidants, phytonutrients and amino acids, including detoxifying amino acids. It won't hurt to support the liver. Whether we do this through supplementation and include, for example, milk thistle, or it will be chitosan or N-acetylcysteine, or even supplementation with detoxifying amino acids, and here I mean just cysteine, taurine and glutamine. And finally, I'd consider basic chelation, taking products such as alpha-lipoic acid, DMSO or EDTA. Before we get to this stage, we should first improve the gut, diet, etc. Stress and stress management are very important in Hashimoto's disease. During stress, a lot of cortisol is secreted, and this can disrupt gut flora, causing gut dysbiosis. This changes the immune system and the secretion of interleukin-17, which is closely associated with autoimmune diseases, i.e., we don't manage stress well and cause the immune system to shift towards autoimmune diseases, whether it be Hashimoto's or Graves'. In any case, interleukin-17 will play a negative role in this case, and managing stress is important. When I tell my patients that they need to supplement or change their diet, everything is fine. However, when I tell them that they must control their stress, this turns out to be a big problem. We can also try to influence this to some extent through the diet by providing good minerals. And here, I would suggest reading about several diets. The first is the diet of Dr. Joel Fuhrman, who invented the Andy Index. This is an index that tells you which of our food products have the most value. And according to this index, kale is at the top. Of course, I don't encourage anyone to eat only kale because this is impossible, but as an addition, it works very well. The next diet, the more products from the high Andy Index we eat, the better for our mineralization. Another scale or diet, whatever you want to call it, is the ORAC score, which shows the antioxidant power of the products we consume. And here, I suggest you get acquainted with the 4 most important products. Spices have the greatest antioxidant strength. The best are cloves, cinnamon, oregano, and turmeric. I'd like you to include these in your diet because then at least this antioxidation and neutralizing of free radicals will be much more effective. Another diet is the anti-inflammatory diet, which is based simply on eliminating products that are highly pro-inflammatory from the diet. It's actually about balancing them in the diet, because it's not necessarily about stopping eating them altogether. Such highly pro-inflammatory products in our diet are omega-6 and prostaglandins, i.e., arachidonic acid. Of course, products with a high glycemic load are also inadvisable. I use the so-called inflammation factor, developed in the United States by Monica Reinagel. It allows you to simply calculate how much a diet is pro- or anti-inflammatory. I calculated what Poles eat, and it turned out that on the inflammation factor scale, they eat pro-inflammatory foods at the level of 1,200, while the recommendation is plus 200. So, we have a lot to do, a lot to read, and learn about which products are anti-inflammatory. And if we start using them in the diet in balance with normal products that we need to live, we will achieve success. Thank you very much.